Welcome back to the deep dive. Today, we are tackling something really important, a question that comes up a lot, often wrapped in quite a bit of cultural baggage and maybe some fear.
Absolutely.
Can the female uterus actually be damaged, physically weakened or worn out by having sex frequently?
Yeah, this is such a critical topic for sexual health literacy. It's vital we clear this up.
Okay.
Because this myth, this idea of a worn-out uterus or vagina, it's not just wrong biologically. It causes real anxiety. And frankly, it can stop people from looking into actual causes of pain or just enjoying a healthy sex life.
Right. So our mission today is to cut through that subjective stuff, the fear about excessive anything, and get to the facts. What does the anatomy, what does the gynecological consensus tell us?
That's exactly it. Clarity based on science.
And we think you'll find some of the body's own protective mechanisms pretty surprising. So let's get straight to it. Based on everything we know medically, what's the definitive answer? Can sex, the physical act, damage the uterus?
The answer is a very clear, unambiguous no.
No.
The uterus itself, structurally, is safe from damage caused by intercourse. And that holds true regardless of how often someone has sex.
So if it's such a clear no from a medical standpoint, why is this myth so persistent? Why this kind of collective anxiety about wearing out such a vital organ?
Well, I think it really boils down to a lack of understanding about the anatomy, a fundamental misunderstanding.
Okay.
People often imagine the reproductive organs are somehow delicate, fragile, maybe. And the term excessive, when you apply it to uterine damage from sex, it's not a medical concept.
Right.
Because the forces involved in intercourse, they don't even come close to the threshold needed to injure that specific organ. Not even close.
Okay, let's unpack that. Let's look at the actual physical evidence, the anatomy that makes the uterus so robust. Where does that protection start?
It really starts with where it is and how it's held. The uterus, it's pear-shaped, and it sits deep inside the pelvis.
Tucked away.
Exactly. It's really well shielded by the bones of the pelvic girdle. Think of it like a natural helmet almost, the hard pelvic bone surrounding it.
And it's not just floating in there, is it? It's supported.
Oh, absolutely not. It's held securely by this intricate network of ligaments. You've got the broad ligament, the round ligaments, the uterosacral ligaments. These basically anchor the uterus. They keep it stable. But importantly, they also allow for some give, some flexibility for movement, arousal, pregnancy, even just, daily activities.
So it's protected deep inside. What about the initial point of contact then? What acts as the first line of defense, that dynamic buffer?
That would be the vagina, absolutely. The vagina is this incredible muscular tube. It's designed for elasticity, for significant stretching.
Right.
So during typical intercourse, its natural length, its ability to expand its muscular walls, they absorb the brunt of the force. It means direct, high-impact hits on the uterus itself are generally prevented.
Okay, but here's where it gets really interesting. Something you mentioned earlier, the body's active defense, the tenting effect. How does the body physically shift things around during arousal to protect itself?
Ah, yes, tenting. It's fascinating physiology. As arousal builds, the muscles around the upper part of the vagina relax. And the whole structure of the uterus and the cervix actually lifts upwards and pulls back away from the vaginal opening.
It literally moves.
It literally elevates, yes.
Okay.
It tenses or balloons upwards. This lengthens the vaginal canal and actively pulls those deeper structures, like the cervix, further away from the direct path of penetration. It maximizes the buffer zone.
That makes sense. But if tenting is so effective and the vagina is a good buffer, why do people still sometimes experience pain from deep cervical contact? That's a common issue, isn't it?
It is, and that's a really important distinction to make. Tenting minimizes contact, but it doesn't necessarily eliminate it completely.
Okay.
Especially, depending on sexual positions or if penetration is particularly deep. Vaginal canal length varies, penis length varies.
Right.
So if the thrust is deep enough, contact with the cervix can happen. But the key thing here is the cervix is sort of the end stop. Discomfort there, even significant aching, isn't damage to the uterus itself, it's pressure on the cervix.
Okay, that's a critical difference. But let's just say, hypothetically, some force did get past the vagina, past the cervix, and reached the main body of the uterus. There's still another layer of protection, right? The muscle itself.
The ultimate protection, the myometrium, yes.
Let's get that.
So the uterus wall has 3 layers. The middle layer, the thickest one, is the myometrium. It's pure muscle. And we're not talking about just any muscle.
No.
No, this is arguably one of the strongest, most resilient muscle tissues in the entire human body. Its power is incredible.
And its strength is designed for something far more intense than sex, isn't it?
Exactly. Its primary job is childbirth, contracting powerfully, rhythmically for hours to expel a baby. The forces involved in labor, the immense sustained pressure and tension are just orders of magnitude greater than anything experienced during intercourse. Trying to damage that muscle through sex is, well, it's just physiologically nonsensical. It's built to withstand so much more.
That really puts its capability into perspective. So if the uterus itself is this biological fortress, we need to tackle that other part of the myth, the idea about frequency wearing out or loosening things, especially the vagina.
Ah, yes, the loosening myth.
Yeah.
It's incredibly persistent, often mixing up muscle tone with, I don't know, fabric wearing thin.
Yeah.
Let's be crystal clear. The vagina cannot be worn out like an old sweater.
Right.
This doesn't work that way. The vaginal tissue itself is incredibly elastic. It's designed to stretch and return to its resting state repeatedly.
So what actually determines that feeling of tightness or looseness that people talk about, if it's not frequency of sex?
That comes down almost entirely to the pelvic floor muscles.
Oh.
Specifically, muscles like the pubococcygeus. These form a kind of sling supporting the pelvic organs. Their tone is what creates that sensation.
And what affects that muscle tone?
Things that genuinely impact it are childbirth, definitely. The effects of gravity over time, hormonal changes, especially around menopause, and overall core muscle fitness. Those are the big players.
Not how often you have sex.
Not how often you have sex. That doesn't significantly change the resting tone of healthy pelvic floor muscles.
Okay, so let's bring this together for the listener. If the uterus is safe, the vagina isn't wearing out, why do some people experience very real, sometimes very deep, pain or discomfort during intercourse? Pain is always a signal, right? It means something.
Absolutely. Pain is the body's alert system. But we need to understand what it's signaling. As we touched on, probably the most common cause of deep discomfort is direct cervical contact.
Bumping the cervix.
Exactly. The cervix has a lot of nerve endings. When it gets bumped repeatedly or too hard, it can cause this deep, achy, sometimes even crampy pain. But again, that's mechanical pressure. It's positional.
So changing position or depth might help that.
Often, yes. It's signaling too deep or wrong angle for comfort, not you're breaking the uterus.
What about spotting or light bleeding after sex? That can be really alarming and easily mistaken for internal injury.
Understandably alarming, but it's almost always superficial. It's often due to something called cervical ectropion.
Okay, what's that?
It's where the softer glandular cells from inside the cervical canal are slightly present on the outer surface of the cervix. These cells are more delicate, more vascular.
So they bleed easily with friction.
Precisely. Friction causes tiny blood vessels to break. It looks scary, but it's usually not related to internal organ damage. It's generally benign. Still worth getting checked out if it persists, of course.
Okay, so beyond the cervix itself, what about the surrounding areas? Can they get irritated, especially if things aren't, say, well lubricated?
Yes, definitely. If that vaginal buffer zone isn't adequately prepared, not enough arousal, not enough lubrication, then the vaginal walls themselves can experience some trauma.
Like what?
Minor things like vaginal abrasions, tiny superficial tears. They might sting or burn a bit, but they heal quickly. In very rare cases with extreme force or lack of readiness, you could potentially get a more significant tear, a laceration. And, importantly, vigorous sex can also flare up pre-existing chronic pain conditions like vulvodynia or vestibulodynia, where the external vulvar tissues are already hypersensitive.
Right, making existing sensitivity worse.
Exactly.
Now let's get to what are often the hidden culprits for consistent deep pain during sex, the underlying medical conditions that get aggravated by intercourse. These need proper diagnosis. Let's start with endometriosis.
Endometriosis is a huge one for deep dyspareunia, which is the medical term for painful sex.
Right.
With endo, tissue similar to the uterine lining grows outside the uterus on ligaments, ovaries, the bowel. So when deep penetration occurs, it can physically push against or pull on these implants. That causes significant pain, often during and lingering afterwards. The movement itself irritates those misplaced tissues.
And then there's a condition where the issue is within the uterine wall itself.
Yes, that's adenomyosis. Here, the endometrial tissue grows into the myometrium, the muscle wall.
Ah, okay.
This makes the uterus itself enlarged, boggy, inflamed, and tender. So any jarring motion during intercourse puts direct stress on an already sensitive organ, leading to that deep cramping pain.
And fibroids. Benign growths But can they cause pain?
Uterine fibroids definitely can, yes. If they're large or if they're located in a place where deep penetration physically bumps or pushes against them, that can certainly cause pain.
What about infections or structural issues?
Absolutely relevant. Pelvic inflammatory disease, PID, that's an infection of the reproductive organs, causes widespread inflammation and tenderness. Any movement, including sex, becomes painful.
Makes sense.
And structural things like significant pelvic organ prolapse, where the support structures have weakened and organs like the uterus or bladder have dropped, that can obviously make intercourse mechanically difficult and uncomfortable.
And the crucial point for all of these endometriosis, adenomyosis, fibroids, PID, prolapse, is that they are the cause of the pain,
Correct.
not the result of having sex too much.
Precisely. Sex might aggravate the symptoms, make the pain noticeable, but it didn't cause the underlying condition.
So we've covered the anatomy's resilience, busted the myths, and outlined the real reasons for pain. What's the bottom line from the major medical organizations about frequency and uterine health?
The clinical consensus is unified and clear. Groups like ACOG in the US, RCOG in the UK, they all agree. Excessive intercourse is simply not a recognized medical cause of uterine damage or pathology.
So doctors aren't looking for that.
No. When someone presents with painful intercourse, clinical practice focuses entirely on finding the underlying reason for that pain, the dyspareunia. One of the conditions we discussed, is it positional? Is it lubrication? That's the focus, not blaming the activity itself.
Okay, so bringing it all home for you, the listener, let's quickly recap the absolute key takeaways from this deep dive.
Okay. First, your uterus is safe. It's incredibly strong and not damaged by frequent sexual activity. Remember that fortress comparison.
Right.
Second, pain is a signal. Listen to it, but understand it usually points to cervical contact, issues with arousal or lubrication, or, very importantly, an underlying medical condition that needs checking out.
Okay.
Third, the vagina is resilient. Tightness relates to pelvic floor muscle tone, which is affected by childbirth, age, fitness, not by how often you have sex. That wearing out idea is false.
Got it.
And fourth, take action. If you have persistent deep pain or unexplained bleeding related to sex, don't just put up with it. Don't normalize it. Go see a healthcare provider to find out the real cause.
That's a fantastic summary. The sources really drive home this picture of the uterus as an organ of incredible strength, built for resilience, designed to handle immense forces. So if the body itself is this robust, the focus really needs to shift, doesn't it?
Completely. Away from fear of damage.
Right, away from this unfounded fear and towards maximizing mutual comfort, communication, and pleasure.
That's the essential mental shift, yes.
And the report really highlights how education and open dialogue are the tools to dismantle these old myths. So here's the final thought we want to leave you with today. Given that the female anatomy is fundamentally built for safety during intercourse, how can prioritizing communication, really talking with partners about arousal, about lubrication, about what feels good positionally, what doesn't become the most powerful tool you have, not just for pleasure, but as the real way to ensure a fulfilling, comfortable, pain-free experience that respects this amazing physiology?
That's a great point. The conversation should start there, with connection and comfort, not with misplaced fear.
Exactly. Thank you so much for joining us for this deep dive into uterine resilience. We'll catch you next time.